The embattled state gun law is about to be put to the test. Two key parts are taking effect. Starting today, background checks are required for all gun purchases, including private sales. And then beginning tomorrow, mental health professionals will be required to report the names of patients who they believe are likely to hurt themselves or others. But are the requirements too vague, and how will they be enforced? News 4's Luke Moretti is asking for you tonight. Luke?
Well, Don, backers of the law say the universal background checks are designed to close a loophole in private sales. What we're talking about here is a federal background check that dealers already run before they sell guns. The provision taking effect requires checks by a licensed gun dealer who can charge $10 and then issue a form showing the prospective buyer passed, although there is an exemption.
There is an immediate family exemption that I believe includes spouses, domestic partners, children, and stepchildren. And if we have to have background checks for all transfers of weapons, it is appropriate to have certain exceptions, in my view.
Other provisions taking effect will require mental health professionals to report patients likely to seriously hurt someone. The information would then be cross-checked against a gun registration database.
We all know that it's going to add a lot to our day and not in a manner that's going to benefit our patients.
Dr. Michael Cummings, director of community psychiatry at the UB School of Medicine, says mentally ill individuals are much more likely to be victims of violent crimes.
Yeah, it's about 12 times more likely that a seriously mentally ill individual will be a victim of a crime than a perpetrator. And really only about 4% of violent crimes are committed by those with serious mental illness.
Dr. Cummings says a person reported could end up on the state registry for 5 years. And he says there's no age limit.
There's a lot of concern that this will affect existing treatment relationships and also really added barrier to individuals seeking help.